What if your body was trying to warn you about a deadly condition, but you couldn't recognize the signs? 4 million of Americans over 70, this isn't hypothetical, it's happening right now. Heart failure silently develops, sending subtle distress signals that most dismiss as just getting older. But here's the shocking truth. By the time obvious symptoms appear, irreversible damage may have already occurred. Every day, doctors see patients who waited too long, patients who might have had different outcomes if they'd only recognized these 5 critical warning signs earlier. In the next 20 minutes, you'll discover the silent symptoms that cardiologists urgently want you to know about. These hidden signals could be happening in your body, or a loved one's, at this very moment. The information you're about to hear isn't just important, it could literally save your life or the life of someone you care about. Are you experiencing any of these deadly warning signs without even realizing it? Let's find out. 1. Unexplained fatigue. It starts so gradually you might not even notice it. Tasks that once seemed effortless now leave you exhausted. Getting the mail, walking to the kitchen, or even just getting dressed in the morning suddenly requires more effort than it should. This isn't the normal tiredness that comes with age, it's something more insidious. Unexplained fatigue is often the earliest warning sign of heart failure, yet it's the most frequently ignored.
Why?
Because it's easy to attribute to dozens of other causes: poor sleep, stress, or simply the natural aging process. But here's what's actually happening inside your body when heart failure begins to develop. Your heart is essentially a pump, responsible for circulating oxygen-rich blood to every cell in your body. When this pump starts to fail, even slightly, your tissues and organs don't receive the oxygen they desperately need. Your body responds by prioritizing vital organs like your brain, redirecting blood flow away from less critical areas like your muscles. The result? A profound, persistent fatigue that no amount of rest seems to improve. Dr. Elizabeth Thornton, a leading cardiologist at Northwestern Memorial Hospital, explains it this way: "Many of my patients describe it as feeling like they're constantly walking through waist-deep water. Everything takes more effort. They often say, 'I just don't feel like myself anymore,' but they can't pinpoint exactly why." This fatigue doesn't just affect physical activities. Many patients report mental fog, difficulty concentrating, or feeling overwhelmed by simple decisions, all because their brain isn't getting optimal blood flow. What makes this symptom particularly dangerous is how easily it's dismissed. In a society that glorifies pushing through discomfort, many seniors ignore this critical warning sign until more severe symptoms develop. It's important to distinguish heart failure fatigue from normal tiredness. Here are the key differences to watch for. Heart failure fatigue doesn't improve with rest. You might sleep a full 8 hours and still wake up feeling exhausted. It tends to worsen as the day progresses, especially after physical activity. Even minimal exertion, like carrying groceries or climbing a short flight of stairs, can leave you needing to sit down and catch your breath. Perhaps most telling, this fatigue often appears alongside subtle changes in your activity patterns. You might find yourself unconsciously avoiding activities you once enjoyed because they've become too tiring. Maybe you've stopped gardening, abbreviated your daily walks, or started taking the elevator instead of the stairs without really considering why. If you or someone you love has experienced this kind of persistent, unexplained fatigue, especially if it's appeared gradually over weeks or months, don't wait to see if it improves on its own. This could be your heart's first cry for help, and recognizing it early could make all the difference in your treatment outcomes. 2. Shortness of breath, even at rest. It often begins subtly. Perhaps you notice you need to pause slightly more often during conversations, or you find yourself taking deeper breaths while watching television. Maybe climbing the stairs leaves you more winded than it used to, or you've started propping yourself up with extra pillows at night because lying flat makes breathing uncomfortable. Shortness of breath, what doctors call dyspnea, is one of the most telling indicators of heart failure, particularly when it occurs during activities that never troubled you before, or worse, when you're simply sitting still or lying down. To understand why this happens, we need to look at what's occurring inside your chest. When your heart begins to fail, it struggles to keep up with your body's demand for freshly oxygenated blood. This creates a dangerous backup in your pulmonary system. Imagine a traffic jam where blood can't flow efficiently through your lungs. As pressure builds, fluid begins to leak from your blood vessels into the air sacs of your lungs. These tiny sacs, called alveoli, are where oxygen and carbon dioxide exchange takes place. When they fill with fluid instead of air, breathing becomes increasingly difficult. Dr. Robert Jameson, pulmonary specialist at Mayo Clinic, explains, "The fluid accumulation is often worse when lying down because gravity redistributes fluid that's been pooling in your legs throughout the day. This is why many heart failure patients experience what we call paroxysmal nocturnal dyspnea. They wake up suddenly gasping for air, often between 1 and 3 a.m., and need to sit upright or stand to catch their breath. This particular symptom, breathlessness that worsens when lying flat, is especially significant. It's called orthopnea, and it's so closely associated with heart failure that doctors specifically ask about it during cardiovascular assessments. If you find yourself needing 2 or more pillows to breathe comfortably at night, or if you've started sleeping in a recliner because lying flat feels suffocating, your body may be sending you an urgent warning about your heart's condition. Even more alarming is what cardiologists call Cheyne-Stokes respiration, a breathing pattern where you experience alternating periods of shallow and deep breathing, or even brief periods where breathing stops entirely during sleep. Family members might notice this pattern and mistake it for a sleep disorder, but it could actually indicate advanced heart failure. Here's what makes breathing difficulties particularly dangerous after age 70. Many seniors assume these changes are simply part of getting older, or they attribute them to other conditions like COPD, asthma, or being out of shape. This can lead to dangerous delays in diagnosis and treatment. The reality is that new or worsening breathlessness in older adults should never be dismissed as normal aging. Your lungs don't suddenly lose function because you've had another birthday. If breathing has become more difficult in recent weeks or months, especially if it's interfering with daily activities or sleep, it warrants immediate medical attention. Case studies show just how subtle these symptoms can be. Marion, a 76-year-old retired teacher, told her doctor she had been experiencing a little trouble catching her breath, only after her daughter noticed she'd stopped taking her daily walks. Further questioning revealed she had been sleeping in her recliner for 3 months because lying in bed made her feel like she couldn't get enough air. A cardiac examination revealed moderate heart failure that had likely been developing for over a year. The encouraging news is that when caught early, the fluid buildup causing this breathlessness can often be managed effectively with proper treatment. But the key is recognizing this symptom for what it truly is, not an inevitable part of aging, but a critical warning sign that requires prompt medical attention. 3. Swelling in the legs, ankles, and feet. Have you noticed your shoes feeling tighter lately? Or perhaps indentations remaining in your skin after removing your socks? Maybe you've observed a subtle puffiness around your ankles that seems worse by evening, or pants that fit perfectly in the morning but feel constrictive by dinner time. This swelling, what medical professionals call edema, is more than just an uncomfortable inconvenience. When it appears consistently in your lower extremities, it could be one of the most visible manifestations of heart failure, especially in adults over 70. To understand why this happens, let's explore the connection between your heart and this characteristic swelling. Your heart and blood vessels work together as a sophisticated pressure system, carefully maintaining the balance of fluids throughout your body. When your heart begins to falter, it can't generate enough force to push blood effectively through your circulatory system and back up against gravity. As a result, pressure begins to build in your veins, particularly in the lowest parts of your body, your feet, ankles, and legs. This pressure forces fluid from your bloodstream into surrounding tissues, causing the swelling you can see and feel. Gravity makes this problem worse throughout the day, which is why many heart failure patients notice their shoes fitting more snugly by evening. Dr. Samantha Rivera, vascular specialist at Cleveland Clinic, explains, "What many patients don't realize is that edema isn't just external swelling, it's a sign that fluid retention is happening throughout the body, including around vital organs. The swelling we can see in the legs is often just the visible portion of a much more widespread fluid imbalance." Heart failure-related edema has several distinguishing characteristics that separate it from other causes of swelling. First, it's typically bilateral, meaning it affects both legs equally. It's also usually symmetrical and progresses from the feet upward as heart failure advances. Perhaps most tellingly, it creates what doctors call pitting. When you press your finger against the swollen area for a few seconds, an indentation remains briefly after you remove your finger. The edema associated with heart failure tends to be worse after sitting or standing for extended periods and may improve slightly after a night's sleep when your legs have been elevated. However, as heart failure progresses, even elevation may not significantly reduce the swelling. Many seniors mistake this symptom for arthritis flare-ups, vein problems, or simply attribute it to water retention without recognizing the potentially serious cardiac connection. This misattribution can lead to dangerous delays in treatment. Even more concerning, some attempt to self-treat by drastically reducing fluid intake, which can actually worsen heart failure symptoms and lead to dangerous dehydration and electrolyte imbalances. George, an 83-year-old retired engineer, ignored swelling in his ankles for months, assuming it was related to an old sports injury. He even purchased wider shoes to accommodate what he called his expanding feet. Only when the swelling reached his knees did he mention it to his doctor, who immediately ordered cardiac testing. The diagnosis: moderate to severe heart failure that had likely been developing for years. If you're experiencing persistent swelling in your feet, ankles, or legs, particularly if it's getting worse over time or doesn't fully resolve with elevation, don't dismiss it as a normal part of aging. This visible symptom could be your body's way of alerting you to a serious cardiac condition that requires proper medical evaluation and treatment. If you're finding this video helpful so far, make sure to like and comment below. I'd love to know which symptom we've discussed has surprised you the most. Let me know your thoughts. Now, let's jump back in and reveal the next critical warning sign of heart failure that's often missed. 4. Persistent cough or wheezing. That nagging cough that won't seem to go away despite multiple rounds of cough syrup and throat lozenges? It might not be allergies, a lingering cold, or even the beginning of bronchitis. For many adults over 70, a persistent cough, especially one that worsens when lying down or produces frothy, white, or pink-tinged mucus, could actually be a warning sign of heart failure that's frequently overlooked by both patients and physicians alike. This type of cough develops through the same mechanism that causes the breathlessness we discussed earlier. As heart failure progresses, fluid backs up into the lungs, irritating the airways and triggering the cough reflex. What makes this symptom particularly deceptive is that it often mimics common respiratory infections or chronic conditions like bronchitis, leading many seniors to repeatedly seek treatment for the wrong condition. Dr. Michael Chen, pulmonologist at Johns Hopkins Medical Center, notes, "I've had numerous patients who've cycled through several courses of antibiotics and various cough suppressants, all while their underlying heart condition continued to worsen. By the time the cardiac cause is identified, significant damage has often occurred that could have been mitigated with earlier intervention." There are several characteristics that distinguish a heart failure cough from other types of coughs. First, it tends to be more persistent, often lasting weeks or months without significant improvement. Second, it frequently worsens when lying down and may improve slightly when sitting upright, similar to the breathing difficulties we discussed earlier. Third, the cough may produce a distinctive type of mucus. While a normal respiratory infection typically produces yellow or green phlegm, a heart failure cough often generates clear, white, or sometimes pink-tinged frothy sputum. This pink tinge is particularly alarming, as it indicates the presence of blood in the airways, a sign that fluid pressure in the lungs has become severe enough to damage small blood vessels. If you ever notice this symptom, it warrants immediate emergency medical attention. The sound accompanying this cough can also provide important clues. Many heart failure patients develop a characteristic wheezing or crackling sound, almost like the noise of crumpling cellophane or Velcro being pulled apart. Doctors call these rowls or crackles, and they occur as air passes through fluid-filled air sacs in the lungs. Family members might notice these sounds even before the patient becomes aware of them, particularly when the person is breathing deeply or just after coughing. What makes this symptom particularly dangerous is how easily it's misattributed. Most people naturally associate coughing with respiratory rather than cardiac issues. This misunderstanding often leads to significant delays in proper diagnosis and treatment. Margaret, a 74-year-old grandmother, treated what she called her winter cough with over-the-counter remedies for nearly 4 months before her pharmacist finally suggested she see a cardiologist. Her subsequent diagnosis: moderate heart failure with significant pulmonary congestion. It's worth noting that certain heart medications, particularly ACE inhibitors like lisinopril, can also cause a dry, persistent cough as a side effect. However, this type of cough doesn't produce mucus and isn't typically worse when lying down. If you're taking heart medications and develop a new cough, it's important to discuss this with your doctor rather than assuming it's related to heart failure progression. The bottom line: any persistent cough that lasts more than a few weeks, especially one that worsens when lying down or produces unusual mucus, deserves medical attention. While it might indeed be due to a respiratory condition, ruling out cardiac causes could potentially save your life. 5. Sudden weight gain and loss of appetite. One of the most counterintuitive symptoms of heart failure is the simultaneous occurrence of weight gain alongside decreasing appetite. This seemingly contradictory combination confuses many patients, who naturally assume that gaining weight must be related to increased food intake. However, in heart failure, the opposite is often true. Your body may be retaining pounds of excess fluid even as your interest in food diminishes. The weight gain associated with heart failure has several distinctive characteristics. First, it tends to occur rapidly, sometimes as much as 2 to 3 pounds in a 24-hour period or 5 pounds in a week. Second, it happens despite no significant changes in diet or physical activity. And third, it often appears alongside other symptoms we've already discussed, particularly swelling and breathlessness. Dr. Victoria Williams, heart failure specialist at Cedars-Sinai Medical Center, explains, "What many patients don't realize is that a weight gain of just 2 to 3 pounds over a couple of days can represent several liters of retained fluid. This isn't fat or muscle, it's excess water that the weakened heart can't effectively circulate and eliminate through the kidneys. This fluid retention doesn't just manifest as visible swelling in the extremities. It can accumulate around internal organs and within body cavities, creating pressure and discomfort that directly impacts appetite and digestion. As heart failure progresses, reduced blood flow to the digestive system can cause numerous gastrointestinal symptoms that further diminish interest in food. Many patients describe feeling full after just a few bites, experiencing uncomfortable bloating or nausea after meals, or developing a general distaste for foods they once enjoyed. Some notice that their belts or waistbands feel tighter despite eating less than usual. Others report a metallic taste in their mouth or changes in their perception of flavor, all potential consequences of reduced blood flow and fluid accumulation affecting the digestive system. What makes this combination particularly dangerous is how easily it's misinterpreted. Many seniors attribute sudden weight changes to medication side effects, thyroid issues, or simply getting older. They might not connect unexplained weight gain with their diminishing appetite or recognize both as potential signs of a failing heart. Even more concerning is that some attempt to address the weight gain with severe caloric restriction or fad diets, approaches that can actually worsen heart failure by depriving the body of essential nutrients needed for cardiac function. Others might ignore the loss of appetite entirely, leading to malnutrition that further compromises the heart's ability to function effectively. Regular weight monitoring is one of the simplest yet most effective ways to detect early signs of heart failure. Cardiologists typically recommend that at-risk patients weigh themselves at the same time each morning, after using the bathroom but before eating breakfast, wearing similar clothing. A gain of more than 2 to 3 pounds over 24 hours or 5 pounds in a week warrants a call to your healthcare provider, as it could indicate worsening heart failure that requires adjustment of your treatment plan. Robert, a 77-year-old retiree, noticed he'd gained nearly 8 pounds in 2 weeks despite having little interest in his usual meals. He initially attributed this to aging metabolism and didn't mention it during a routine checkup. Only when his doctor noted elevated blood pressure and lung congestion did the connection become clear. His heart was failing, and the weight gain was entirely due to fluid retention. Prompt treatment with diuretics removed excess fluid and alleviated his symptoms, but earlier recognition might have prevented complications. The key takeaway is this: sudden weight gain that doesn't correlate with increased food intake, especially when accompanied by decreased appetite, should never be dismissed, particularly in adults over 70. This seemingly contradictory combination of symptoms could be one of your body's most important warnings about the state of your heart. Heart failure doesn't announce itself with dramatic chest pain or sudden collapse. It whispers through subtle changes that are all too easy to dismiss. These 5 silent symptoms, unexplained fatigue, shortness of breath, swelling in the extremities, persistent cough, and the paradoxical combination of weight gain with appetite loss, may seem disconnected. But together, they paint a clear picture of a heart that's struggling to keep up with its vital role. For those over 70, recognizing these warning signs isn't just important, it's potentially life-saving. The difference between detecting heart failure in its early stages versus its advanced phases can mean the difference between managing a chronic condition and facing a medical emergency. Don't wait until these whispers become shouts. If you've recognized any of these symptoms in yourself or someone you love, reach out to a healthcare provider immediately. Remember, when it comes to heart failure, early intervention doesn't just improve outcomes, it saves lives. The warning signs are there. The question is, are you listening? While we've covered the 5 primary warning signs of heart failure, there are several additional symptoms that deserve attention, particularly in adults over 70. These include irregular or rapid heartbeat, heart palpitations or the sensation that your heart is racing, skipping beats, or fluttering, can indicate that your heart is working harder to compensate for reduced pumping efficiency. Many patients describe this as a feeling of their heart doing flip-flops or pounding even when they're at rest. Dizziness or confusion. As heart failure progresses, reduced blood flow to the brain can cause cognitive changes ranging from mild confusion to significant disorientation. Family members might notice their loved one becoming increasingly forgetful, having difficulty following conversations, or showing uncharacteristic confusion about time, place, or familiar tasks. These symptoms often worsen during physical activity when the compromised heart struggles even more to supply adequate blood to the brain. Nocturia, the frequent need to urinate at night, medically termed nocturia, is often dismissed as a normal part of aging or attributed to prostate issues in men. However, it can actually be a sign of heart failure. When you lie down to sleep, fluid that has accumulated in your lower extremities during the day is reabsorbed into your bloodstream. Your kidneys then filter this excess fluid, leading to increased urination during the night. If you find yourself needing to use the bathroom multiple times during sleeping hours, particularly if this is a new or worsening pattern, it could be related to heart function. Loss of muscle mass. Advanced heart failure can lead to a condition called cardiac cachexia, severe weight loss that affects not just fat but also muscle tissue. This occurs as the body enters a catabolic state, breaking down its own tissues in response to the metabolic stress of a failing heart. If you've noticed unexplained muscle wasting, particularly in the context of other symptoms we've discussed, it warrants immediate medical evaluation. It's important to understand that heart failure symptoms often appear in clusters and tend to worsen gradually over time. The presence of multiple symptoms significantly increases the likelihood of a cardiac cause. Additionally, symptoms may fluctuate. Having good days and bad days doesn't mean the underlying condition is improving or resolving on its own. Risk factors that make these symptoms even more concerning include history of heart attack or coronary artery disease, long-standing high blood pressure, diabetes, sleep apnea, valvular heart disease, family history of heart failure, previous chemotherapy or radiation to the chest. If any of these risk factors apply to you and you're experiencing one or more of the symptoms we've discussed, the urgency for medical evaluation increases substantially. While heart failure is a serious condition, early detection and proper treatment can significantly improve both life expectancy and quality of life. Modern management approaches include medication therapy. Several classes of medications have proven highly effective at improving heart function, reducing symptoms, and extending life. These include ACE inhibitors, ARBs, beta blockers, aldosterone antagonists, and the newer SGLT2 inhibitors. Many patients see dramatic improvement with appropriate medication regimens. Lifestyle modifications. Simple changes like reducing sodium intake, monitoring fluid consumption, engaging in appropriate physical activity, and getting adequate rest can significantly reduce symptom burden and slow disease progression. Device therapy. For some patients, devices like pacemakers, implantable cardioverter defibrillators, ICDs, or cardiac resynchronization therapy, CRT, devices can improve heart function and reduce the risk of life-threatening complications. The most important step you can take if you recognize any of these warning signs is to seek prompt medical attention. Start with your primary care physician, who can perform initial evaluations and refer you to a cardiologist if necessary. Be prepared to describe your symptoms in detail, including when they started, what makes them better or worse, and how they impact your daily activities. Remember, heart failure is not a death sentence. With proper diagnosis and treatment, many people live active, fulfilling lives for many years after diagnosis. The key is recognizing the warning signs and taking action before significant damage occurs. If you've recognized any of these heart failure symptoms in yourself or someone you care about, addressing your blood pressure could be a critical first step toward better heart health. High blood pressure silently damages your cardiovascular system and dramatically increases heart failure risk, especially after age 70. That's why thousands of Americans are turning to Basopril, a breakthrough formula developed specifically to support healthy blood pressure levels with a proprietary blend of supernutrients and herbs. What makes Basopril different is its scientific foundation. Each ingredient has been selected based on rigorous clinical research demonstrating real cardiovascular benefits. Unlike generic supplements, Basopril's unique formulation works with your body's natural processes to support optimal blood pressure, promote healthy circulation, and help maintain proper heart function. Don't wait until these silent symptoms progress to something more serious. Click the link in the description below or check the pinned comment to discover how Bezapril can become an essential part of your heart health strategy today. Your heart deserves this scientifically backed support. Take that first step toward better blood pressure now.